In modern medicine, a surgeon is a physician who performs surgery. There are also surgeons in podiatry, dentistry, orthodontics, and veterinary medicine. The first person to document a surgery was the 6th century BC Indian physician-surgeon, Sushruta or Sushruta. He specialized in cosmetic plastic surgery and even documented an open rhinoplasty procedure. His magnum opus Sushruta Sanhita is one of the most important surviving ancient treatises on medicine and is considered a foundational text of both Ayurveda and surgery. The treatise addresses all aspects of general medicine, but the translator G.D. Singhal dubbed Sushruta the father of surgical intervention, on account of the extraordinarily accurate and detailed accounts of surgery to be found in the work. After the eventual decline of the Sushruta school of medicine in India, surgery was largely ignored until the Islamic Golden Age surgeon Al-Zarawi re-established surgery as an effective medical practice. He is considered the greatest medieval surgeon to have appeared from the Islamic world, and has also been described as the father of surgery. His greatest contribution to medicine is the Kitab al-Tazrif, a 30-volume encyclopedia of medical practices. He was the first physician to describe an ectopic pregnancy, and the first physician to identify the hereditary nature of hemophilia. His pioneering contributions to the field of surgical procedures and instruments had an enormous impact on surgery, but it was not until the 18th century that surgery emerged as a distinct medical discipline in England. In Europe, surgery was mostly associated with barber surgeons who also used their hair-cutting tools to undertake surgical procedures, often at the battlefield and also for their employers. With advances in medicine and physiology, the professions of barbers and surgeons diverged. By the 19th century, barber surgeons had virtually disappeared, and surgeons were almost invariably qualified doctors who had specialized in surgery. Surgeon continued, however, to be used as the title for military medical officers until the end of the 19th century. And the title of Surgeon General continues to exist for both senior military medical officers and senior government public health officers. In 1950, the Royal College of Surgeons of England, but the length of postgraduate medical training outside North America is such that a qualified surgeon may be years away from obtaining such a post. Many doctors previously obtained these qualifications in the senior house officer grade, and remained in that grade when they began subspecialty training. The distinction of Mr. is also used by surgeons in the Republic of Ireland, some states of Australia, Barbados, New Zealand, South Africa, Zimbabwe, and some other Commonwealth countries. In many English-speaking countries, the military title of surgeon is applied to any medical practitioner. Due to the historical evolution of the term, the U.S. Army Medical Corps retains various surgeon United States military occupation codes in the ranks of officer pay grades. For military personnel dedicated to performing surgery on wounded soldiers, some physicians who are general practitioners or specialists in family medicine or emergency medicine may perform limited ranges of minor, common, or emergency surgery. Anesthesia often accompanies surgery, and anesthesiologists and nurse anesthetists may oversee this aspect of surgery. Surgeon's assistant, surgical nurses, surgical technologists are trained professionals who support surgeons. In the United States, the Department of Labor description of a surgeon is a physician who treats diseases, injuries, and deformities by invasive, minimally invasive, or non-invasive surgical methods, such as using instruments, appliances, or by manual manipulation.